I'm Paulina Leiser, producer of Focus Today. Thank you for watching this video, and make sure to check our other videos at theDove.us.
Welcome back to Focus Today, and delighted to have back with us Twila Brase. She's the president and co-founder, Citizens Council for Health Freedom, and it's CCHF, and if you want to go to their website, it's cchfreedom.org. And Twila, good to see you. How you doing?
I'm doing well, thank you.
You bet. Well, what do you think of Congressman Dr. Tom Price being named head of the HHS?
Well, I think that Dr. Price is perhaps one of the best choices that could have been made for this position. He is a physician, he's an orthopedist. He has a great deal of experience just in delivering healthcare. And then for the last 12 years, he has been a member of Congress. He's chair of the Budget Committee. He is a member of the subcommittee of the Ways and Means Committee. So, the subcommittee of health within the Ways and Means Committee. So he has a lot of experience both on with the practical side, so the actual practice of medicine, and then a lot of experience in Congress and dealing with healthcare pricing. And then he has the only bill that has detailed his repeal and replacement plan. And I will say just from the onset that we have supported a repeal, just a strict repeal without replacement, because we're concerned about the replacement. We're concerned that that if they want to wait for the replacement to get the repeal, we'll never get the repeal. Or we're concerned of the possibility that a replacement plan could just be another version of the federal government in control of health insurance. So we'd like everything to go back to the states. But really, when it comes, Congressman Price has said that he's open to other people's ideas other than his own bill. So, I just think that he knows a lot. I think he's open, and we will see where it goes from there. I will say that in his bill, he has a repeal section, and I counted yesterday the number of words. So it's only 56 words long. So a repeal of Obamacare requires only 1 page and 56 words. He has a replacement in the other 239 words of the bill. But we could have just a simple repeal of Obamacare, and then we can go on to talk about what might happen afterwards.
This is interesting because President-elect Trump has recommended replace and repeal, and he spent more time on replace because I think originally he was for sending it back to the states. Now there's been a little bit of a change, and that is, well, what do we do with pre-existing and a few of other things that are wrapped up in Obamacare? Can it be completely repealed and sent back to the states and then put a period there, or are we stuck with some of this stuff?
We're never stuck with anything. All laws can be repealed. All laws can be changed, amended, etc. I will say that the pre-existing condition part, a lot of people don't understand that. My guess is that President-elect Trump doesn't understand that either. But that piece, that guaranteed issue, no matter how sick you are, that an insurance company has to offer you coverage and at no greater price than anyone else, that piece is the centerpiece of Obamacare, and it is what blew up everything. It's why the prices are skyrocketing, because the mandate isn't really a mandate. You can get out of the mandate if you either find an exemption or if you pay the penalty, which isn't even half the cost of actually purchasing the insurance itself. So lots of people are finding exemptions, doing health sharing, or just paying the fine. And because their money isn't in there, and because everybody with pre-existing conditions came in there, that's why the premiums are now highly unaffordable. The deductibles are unaffordable, the premiums are unaffordable, and everybody is, terrified. It's more than their mortgage payments for a lot of people. It's a third of some people's income. And so that just has to go. So pre-existing conditions, so that your viewers and listeners can understand, pre-existing conditions were actually taken care of by the states before Obamacare. 35 states had what's called a high-risk pool for people with pre-existing conditions, and most of them had those folks pay 125 to 150% more. So whatever the price was, if you add another quarter onto it or another half onto it, that's what they'd have to pay. They could still get coverage. It was a government program for people with pre-existing conditions, but it was handled by the states. It could be handled by the states again. But at the end of the day, just let me add, we really have to get rid of people having pre-existing conditions. And the way you do that is to get back to personal ownership of your policies. Take them wherever you go. Doesn't matter whether you're employed or not. You're not stuck in your employment thinking, I can't leave because I have this condition. You just own your policy. And then you're never, even if you get sick so that you have to quit your job and then they take away your employer-sponsored coverage, it wouldn't matter, because if everybody owned their own policy, it wouldn't matter if you got sick or not, you wouldn't be losing it.
Boy, a big hearty amen to that. I mean, we're right in the middle of that ourselves as a company, looking at redoing our annual renewal, and it's just atrocious. But that's another thought for another day. It's been said this, Twila, that, and I'm going to go down the road that you favor, and that is we need to repeal it, period, because if you leave any part of it in place, you have the weight of the Supreme Court's decision behind you enforcing that. So the best thing you can do is repeal it. But you got to have something there immediately to pick up the gap. So logistically, how's this done?
So they can do things like, repeal it and have a 12-month delay. They could do that sort of thing. Once they repeal it, a certain number of things happen immediately. For instance, the companies that offered health insurance that were indemnity policies, truly affordable, real health insurance that wasn't for routine and minor conditions, but actually was there for the catastrophe, that could come back. Obamacare obliterated it. It prohibited it. It made it unlawful, illegal. That would just be instantaneously legal again. And so all those companies could just, sort of like re-up what they had before and make it available. States, they could do, grants. That would be an easy thing to just do block grants to the states for Medicaid, and then states could decide what to do with the entire Medicaid population. There are a number of other things that could happen. For instance, I was just thinking of the Medicare population, but probably most people's concerns are Medicaid and the people that are in Obamacare. But a lot of the people that are covered under Obamacare are people who were eligible for Medicaid before Obamacare. They were eligible. They just didn't come in. But under the mandate, they felt afraid, and then they came in. It was called the woodwork effect. They all came out of the woodwork. But they were eligible before. So those 20 million people that have been covered, most of them were eligible before Obamacare ever came into effect. So lots of people would not be left out on the streets, as some of the proponents say.
So there is hope. You're going to get a new HHS Secretary. He understands the problem. He's a doctor. He's put forth legislation to repeal Obamacare. At least it's turned around and heading in the right direction.
That's right. That's right. So, they say the first 100 days, it would be the interesting thing about this, of course, is that the new Congress really begins on January 3rd, and President Trump will be inaugurated. President-elect Trump will be inaugurated and become president on the 20th of January. So there's this time between where they could pass the repeal bill and put it on his desk on day one. Now, there's one really important thing to talk about with the repeal. So there are two ways to do repeal, and we would like to do it one way with a backup as a second way. So what we would like to do, which a lot of people say is impossible because we do not have a filibuster-proof Senate. So the Democrats can stand up. If you try to just put a full repeal bill through there, they can stand up and they can filibuster all day long. They'd have to do it 24/7. They'd have to start reading from phone books or, whatever they wanted to do. They could do it to keep the bill, just that one-page bill, from moving forward. But I think that's what the Republicans should do. They should make the Democrats stand up and filibuster the repeal of Obamacare, very unpopular Obamacare, the Obamacare that has caused people to lose their jobs and make decisions about whether they can be insured or uninsured or lose their insurance, right? They need to just make them do that. At the end of the day, the Democrats are willing to filibuster for days on end, right? Then the Republicans could decide to do it through a process called budget reconciliation. It would only be a partial repeal of Obamacare. It would be handicapping and disabling to Obamacare because it would take all of its money away. So it would sit there pretty much disempowered, not totally, but pretty much disempowered. But the preference is really, let's bring the real repeal bill and let's have the Democrats filibuster by saying why it should stay in law. And then if all else fails, do the partial repeal until we can, get someday a filibuster-proof Senate.
You've really thought this out. All right, so people can go to your website, cchfreedom.org, cchfreedom.org, and that stands for the Citizens Council of Health Freedom, and you can learn more about that. I only got about a minute left. What else would you like to see happen in healthcare under this administration?
So on day one, we actually have on our website, cchfreedom.org, we have on our website a list of 10 action items that President-elect Trump could do on day one. And so one of those things is really, really important, and that is to disconnect. I mean, all of them are important, but right on day one, he could just tell his Social Security Administration director or secretary to delink, so disconnect the link between Social Security payments and Medicare Part A enrollment. So that's the part for hospitalization, right? It's not a law. It's not even a rule that the public ever could comment on. But today, if you do not take Medicare Part A, if you do not enroll yourself in the government's single-payer program for seniors, you lose your Social Security benefits. That should not be the case. We should let Medicare folks escape.
Thank you, Twila. Good to see you again. Stay in touch. Again, cchfreedom.org is our website, cchfreedom.org. Best to you. Merry Christmas. God bless. And let's connect again after all this has started, okay?
All right. Thanks, Barry.
Good to see you. All right. We'll see you next time on Focus Today.